Sir, correct. How much importance has biomedical waste and health medicine has been as of now?
See, before 1998, it was totally a neglected issue. After the 1998 biomedical waste rules was drafted and made into force, which came into force from 1998 as part of the Environmental Protection Act of Government of India, it has gained much more importance. But even then, I would say whatever improvement has taken place is only minimal. Much more needs to be done. There is a need for a life cycle approach where improvements are required at the point of generation for segregation of waste, disinfection of waste, containment of waste, safe mode of transportation both within and outside the healthcare settings, and also there is lot of research and also practice required when it comes to eco-friendly final disposal options. And it is purely an attitudinal issue to a large extent. But technology can certainly supplement the attitude part of it. But within the available resources, it is possible to work towards a safe and sound healthcare way. It requires to be recognized much more. Much training is required for doctors, nurses, support staff. Orientation of policymakers is required. And there is a need for a multi-pronged approach where it is viewed as a patient safety approach, a worker safety approach we should keep. And also we should keep an environment safety, community safety approach to the entire problem.
And you being as a HoD of Community Medicine, MS Ramaiah Medical College, what are the programs done in this regard as biomedical waste, health management and community medicine?
See, from 1995 onwards, we established a cell called Healthcare Waste Management Cell in the Department of Community Medicine at MS Ramaiah Medical College, Bangalore. It all started with a workshop in Bangalore Mahanagarapalikhe for 200 medical officers, where Center for Environment Education initiated the process. And there we see that Mr. Ravindra, the former administrator of the Bangalore City Corporation and the former Chief Secretary of the state, he suggested us to draft a manual for healthcare waste management in the hospital. We interacted with the government and suggested that we will do an exploratory study before drafting a manual. We did the exploratory study, and this study was done in 96-97, and the report was presented to Government of Karnataka Standing Committee on Health. The report was accepted by Government of Karnataka, and then we drafted a manual. We interacted with Waste Netherlands, an NGO from Netherlands, and we launched the Malleshwaram Healthcare Waste Management Project, where we field tested our manual. So far, we have provided training to healthcare institutions in Bangalore City, the towns and cities of Karnataka, many towns and cities outside the state, and also we have done 10-day training program for country managers of Maldives. 3 programs we have done, Myanmar we have done, Sri Lanka we have done, and we have conducted legislation workshops, capacity building workshops for all the countries of the Southeast Asia region in Mongolia as part of the support from World Health Organization of the Siro region.
And what about the distance? Any program you have done, like distance education program?
We have collaborated with Indira Gandhi National Open University, and we have a study center in our department. Dr. Hemant Sapse, Associate Professor of Community Medicine and Director of the Healthcare Waste Management Cell, is the program in charge.
So what about the graduation? Is there any program for graduation?
Actually,
in the masters?
Actually, when it comes to training and capacity building in healthcare waste, we have it as curriculum partly in medical, nursing, dental, pharmacy, these courses. It is very minimal. there is a need to strengthen this curriculum. There are courses of MSc, PhD, many people do on general environment. When it comes to healthcare waste management, very few people have attempted to do their PhD. We have one Dr. Pushpanjali from the dental discipline who heads the community dentistry. She is doing her thesis on biomedical waste. Formal training, I would say, need to come up. There is a need for coming up. In fact, it is very necessary that we should have a trained person who has undergone at least a certificate course from the Indira Gandhi National Open University, which can be an in-service training.
What about any collaboration with the Karnataka State Pollution Control Board?
We work hand in hand with Karnataka State Pollution Control Board. For example, say, we have two specific initiatives. One is we have joined with Environment Management and Policy Research Institute of the Department of Environment, where an attempt is being made over the last 6 months to create a team of 6 resource people, from nurses, other health professional backgrounds, doctors, veterinary discipline, so that we provide training of trainers. Likewise, we have had 2 trainings organized by EMPRI. We have collaborated with them, where 13 districts have been trained.
Sir, what is the full form of EMPRI?
Environment Management Policy Research Institute. It is a training wing of the Department of Environment of Karnataka government.
So, is there any officials from Karnataka State Pollution Control Board coming to MS Ramaiah, and have they been giving any?
We have been participating with the trainings and orientations organized by Karnataka State Pollution Control Board, and they are part of our resource for the training programs conducted by us. And in fact, for every training, we do a lot of field visits, and we do field visits to the common biomedical waste treatment facility, and also we have a session on biomedical waste management.
Sir, what about this 11th annual conference which MS Ramaiah Medical College is hosting? Just brief about that one.
This 11th annual,
which is being held on December 3rd to 4th, December 3rd and 4th.
This 11th annual conference of Indian Society of Hospital Waste Management is being planned on 2nd, 3rd and 4th. 2nd is a pre-conference event. 3rd and 4th is the international conference. We expect participants about 150 from all over the country, and there is very good participation from the health department and Karnataka Health System Development Project of Karnataka. And there will be participants from Delhi government. And we expect participants from Defense, Air Force, Navy, as well as Armed Forces, and we are expecting participation from NGOs, and it is likely that we have participants from Sri Lanka.